This is your 12-week clinical recovery blueprint to bulletproof your spine. Dr. Ryan Livingston here, also AKA the Muslim chiropractor. Guys, this clinical recovery blueprint is based on decades and decades of research, tens of thousands of patients and clients' results, and a long time in the industry with decades of research as a medical researcher, decades of understanding and study. So this is going to be an understanding, a foundational guide for you guys to get healthy and stay well. We can advance the exercise later on. We're gonna go through 4 phases here. I want you to follow along with your guide that you guys have gotten. You're welcome to take it with you. You're not gonna go through every single exercise, and that's the beauty of this. This teaches you the foundational elements that you need to build a healthy spine. Because guys, look, if you knew what to do, wouldn't you already be there? And part of that equation is mentorship. If you keep quitting and giving up on yourself, you don't have what it takes, maybe it's time to find a coach or a mentor. And that's exactly what we all do in industries we want to actually thrive in, not just survive. The phase 1 begins with the foundational elements where you're going to get an exam, a consult, or a functional assessment, if you will, to decide and determine where you're gonna start out. As you go through these exercises, we're gonna go through things like the mobility protection. We're gonna go through pelvic trunks, trunk rotations. We're gonna go through some basic stretches where I teach you guys how to elongate the spine, how to start to move in a healthy position, and then rewire and retrain the neurological imbalances along with the structural dysfunctions, especially if you're getting the in-clinic adjustments and rehab. There's nothing better than that, and combining that with this program specifically. Phase 2 is gonna be movement integration, where we start to teach you these patterns. You can start to integrate them in your day-to-day life. You can also start to integrate them into the next phase of care. Phase 3 is the load introduction, and the last phase is gonna be strength and somewhat of a machine integration. It doesn't have to be a machine. It can be bands. It can be some way of getting you back into the environment. But we're gonna start out with these exercises and rehab. So without further ado, let's dive into the actual exercises themselves. And remember, if you haven't already gotten the curriculum that we give to our clients and our practice members, the VIP members, get involved in that, because that teaches you all the basics and structural foundation of what a healthy spine is before you start these types of movements, because these movements are gonna pair well with the fact that you need to know how to have a healthy spine and how to move that spine through its full ranges of motion with rotation. And this guide is gonna incorporate a lot of that with it. Beginning with the mobility exercises, pelvic trunks, trunk rotations, and basic stretches. What are we trying to do here? We're trying to elongate the spine. We're trying to get the spine to have good, normal, healthy biomechanics. So remember, all the stretches you're gonna wanna do are gonna be trying to elongate, stretch, and elongate the spine, because right now, most people, when they're coming to an injury clinic or they're coming to me, have a lot of compressive forces on the spine. The more forward your head is, the more forward your hips are. It creates a tremendous lever arm where a bending moment or a shearing moment in the spine that causes a lot of compression, and that destroys the joints of the spine. As you get that back to a healthy normal, your body can function, act, and operate in an environment it was designed to, which means the joints don't take pressures they're not supposed to and forces they're not supposed to. So that is what I mean by the elongation stretches. So that can be anything from grabbing onto a hanging band, which we'll show you guys in just a second. That can also be anything from grabbing onto a simple heavy weight, stretching like this, or it can be something as simple as grabbing a pair of dumbbells, keeping a good hip hinge, and allowing your back to stretch, keeping your abs tight as you start to come back up to protect and guard the spine, and then coming back down. Okay, this is a very good stretch movement, making sure that you keep your abs tight and come back up, just like that. That is also a very good elongation movement. We're gonna move into the pelvic trunk rotations and the pelvic tilts. Pelvic tilts, very simple and very easy. You can do these standing up, or you can do them on all fours. All fours, and reps and sets, people always ask me about. Look, reps and sets don't really matter. I want to teach you the foundations of health and movement here. The foundations of health and movement mean that you understand why we're doing what we're doing, so that you understand how many reps, sets, etc. we're going to do. You really want to go to you can't do any more. That's when fatigue sets in, and that's when growth starts to occur. So we can lay out a number of sets and reps, but if that's super easy for you, then it's not doing you any good. So all fours, we're going to drop the stomach, and then we're going to pelvic tilt. So this looks very familiar for those who do yoga. This is effectively a cat-cow. But you're really focusing on really trying to make all that movement come from the lumbar spine here, okay? You can also do that standing up, which I teach patients all the time. Pelvic tilt, they need an extension. Pelvic tilt, extension. Another great way to do that is you're laying on your back like this. And from here, you're going to tilt the pelvis. So you can notice my butt comes off the ground ever so slightly. Back down, up nice and slow, hold, 5, 4, 3, 2, 1, and back down, back up, 5, 4, 3, 2, 1, and back down. As you really want, you can squeeze about 50% of your maximum effort, hold for 5 seconds, squeeze 60% of your maximum effort, hold for another 5 seconds, and then hold, squeeze again, maybe 70% or 80% of your max effort, almost like an ab crunch, and hold for another 5 seconds. Now this may seem simple, but this is the prerequisite to a lot of other exercises. So you're gonna have to engage the core, engage the pelvic tuck, and then perform some other exercises. A perfect example of this is the hip rocking. This is T hip rocking because we're making the letter T. And I prefer to do this with a pelvic tuck first. You can do both, but the pelvic tuck is helping retrain your spine and your nervous system to engage in that core throughout your movement. If you can retrain that, you will have a much better chance of protecting your spinal column and spinal cord. And that is T hip rocking and the pelvic tilts. On to the next series of exercises, which you have here following along in your guide. Glute bridges, opposite arm, opposite leg extensions, planks, body weight squats, and hip extensions. So the body weight squats and hip extensions, we'll start with first. They're simple, just like this. You can come up and you can even do hip extensions like this. Come back down, and then hip extensions like this. There's so many ways to do hip extensions. There's an infinite number of ways to do that. I like that one specifically. You can even grab a kettlebell, which I will do in just a second. Glute bridges, opposite arm leg. Glute bridges are gonna go back to exactly what we showed you before, the hamstring pelvic tilt, or the hamstring exercise, the pelvic tilt exercise, where you're gonna pelvic tilt, and then you're gonna drive through the heels like you're doing a squat. Tilt first, squeeze about 50% effort in the pelvic tilt, come up like this, okay? The more advanced exercise, you're gonna hold this for 10 seconds and then come down a full 10 seconds. The advanced exercise is coming up, and instead you're gonna be on a balance ball. So your feet will be placed on a ball, and then you're gonna pelvic bridge or up like this. And then even more advanced is you could roll out and then roll back while keeping that exact same nice angulation here, okay? The butt shouldn't drop, and it shouldn't also hyperextend like this, okay? Not that that's bad for you, but that's not what we're doing. We're trying to train the core while we're doing these exercises. Opposite arm leg extensions and planks. I'm gonna show you at an angle here. Again, pelvic tilt, nice and gentle, 50% effort. Opposite arm, opposite leg. I'm still engaging the pelvic tilt. Come back, opposite arm, opposite leg. Notice how slow I'm doing this. And again, guys, sets and reps. 3 sets of 15 each side should be sufficient. Start with 10 reps each side for 2 sets, and then work up to 3 sets of 15 reps each side. Nice and slow. I am not going fast. A more advanced version would be extensions, come back, get some rotation in there, touch knee to elbow, come back out, come back down. Guys, nice and slow. I've been doing this for decades. I know what patients and clients do. You guys go way too fast. Everyone always asks me, how do I look so big? I don't take anything, I just work out. I go slow and controlled, and that's the recipe for the magic there, okay? Planks, and I'm gonna grab a kettlebell. Planks, also very easy. You can start as much as you can. If all you can do is plank like this on your knees, again, pelvic tilt. This is your plank, and then this is how you start out. That's fine, this is amazing. Keep the pelvic tilt, plank like this. Eventually, you can get to a plank where you're on your toes, straight up and down. Don't let the butt sag, don't go up too high. Nice pelvic tilt and a neutral spine. Then eventually you can come up to your hands, which this is one of my favorite exercises. Back to the elbows, back down, arm, arm, elbow, elbow, and then mix it up.